Hello everyone, my name is Collette and today I will be presenting RJ, a 2-month-old Caucasian infant female who was brought in by her mother with a chief complaint of, I brought her in today for her wellness visit. So, again, with her HPI, RJ is a 2-month-old infant, healthy appearing Caucasian female who presents to the clinic today accompanied by her mother who appears to be a good historian. RJ is here for her 2-month wellness visit and her mom states she also has concerns that RJ has not been eating well for the last 4 days. Per mom's report, RJ has been eating well up to 8 2-ounce bottles of formula per day up until her formula was switched to a low iron-based formula about a week ago. The mom states since RJ has been on this new formula, she has had inconsolable crying up to 3 hours at a time with her episodes. She has been in a very fussy mood, and it is associated with vomiting, abdominal bloating, and you can see her fists become very clenched when she's crying. This is making everybody in the household have trouble sleeping, and per her mom's report, RJ hasn't had a bowel movement for the last 3 days. Her mom also states that she has tried over-the-counter Mylicon drops to help, but she had no relief, and it wasn't giving her much gas relief. The mom denies that RJ is having any trouble urinating. She still has 10 to 12 wet diapers per day. The mom also denies any foul urine smells. She denies any fever, and she states that RJ hasn't been around any sick contacts. She is also here today for her routine immunizations. Her past medical history includes RJ doesn't have any major illnesses, and her mom reports that she had a normal vaginal delivery at 39 weeks gestation. RJ was born 7 pounds and 8 ounces, and her APGAR score was 9 out of 9. Mom reports there was no complications with the pregnancy or any known birth defects, and it was a very uncomplicated birth. RJ doesn't have any past hospitalization or any past surgical history. RJ also does not have any, mom denies that she has any allergies, any seasonal allergies, any food allergies, or any known drug allergies. Again, RJ current medications include over-the-counter Mylicon drops, which she uses PRN for gas pain, and Tylenol liquid drops, which she uses every 6 hours when RJ had her first set of immunization and as needed for pain. The family history includes the mother, who is 28 years old. She is healthy. A father, age 31, alive and healthy. A maternal grandmother, age 51, alive with a history of diabetes type 2. A maternal grandfather, alive, age 51, with a history of hypertension and hyperlipidemia. A paternal grandmother, age 52, who is alive with a history of hypertension, and a paternal grandfather, age 53, alive with a history of hypertension. RJ doesn't have any siblings, and her mother reports there is no history of cancers or blood dyscrasia or Down syndrome in the family. As far as the social history goes, the mother denies that there is anyone in the household who's using alcohol, smoking, or any other illicit drugs. RJ lives in a 2-story house with her both parents, and they both are employed. RJ goes to her grandparents' house 5 days a week while her parents are working, and she usually doesn't have any trouble with bottle feeding. and she drinks water at night. She uses a car safety seat when traveling, and she rides backwards. The mother reports there is no domestic violence in the home, and there are no guns in the household. Also, she has child-proofed the household with locks on the cabinets as well as safety gates around the house. For her review of systems, the mother denies any fever, any weight loss or weight gain, no excessive sweating or changes in her activity. The mother also denies any trauma, any seizures or inactivity to the head, denies any developmental delays. In her eyes, the mother denies any changes in her vision, denies eye drainage or redness, denies any hearing loss, any drainage or pain in the ear, and denies any runny nose or congestion or trouble swallowing. Cardiovascular-wise, she denies any shortness of breath, any color changes, any palpitation, or any chest pain. No episodes of fainting or dizziness is also denied. She denies with her respiratory any coughing, any wheezing, and denies any other shortness of breath. As far as GI, the mom reports that there is vomiting, reports there is nausea before vomiting, and reports that constipation, but denies any diarrhea, denies any blood in the stool, and her last bowel movement was about 3 to 4 days ago. GU-wise, the mom denies any foul-smelling urine, any trouble urinating, denies any urgency, denies any frequency, denies any blood in the urine. Endo, she denies any problem in the growth pattern, and denies any heat or cold intolerances. Musculoskeletal, she denies any weakness, any joint pain, any joint abnormalities or deformities. She denies any, on the skin, she denies any rashes, any bruises, or any other lesions on the skin. Psych, the mom reports that she has been in a very fussy mood. Her laboratory and diagnostic, today RJ is here for her follow-up on her immunization, which is she going to get her first dose of her rotavirus, her first dose of her DDaP, and her first dose of her Hib, her Prevnar 13 first dose, and her polio vaccine first dose, as well as her second dose of her hepatitis B to be up to date with her 2-month immunization. Objectively, we're looking at RJ weight. She is 23 pounds. She is 22 centimeters. She has a temperature of 98. Her head circumference is normal. And her physical exam reveals her general she looks healthy, appearing infant child. Her head is atraumatic, non-cephalic. Interior fontanelles are soft, they're flat, they're non-bulging. Her pupils are equal, round, reactive to light. Her scleras are clear, the present red reflex bilaterally. In her ears, her tympanic membranes are clear bilaterally. There's no redness, no drainage. And in her mouth, her mucous membranes is soft. Her gums are pink and moist. Her neck is supple with no lymphodemia. As far as her respiratory, her lungs are clear to auscultation. There is no wheezing, no crackles, no accessory muscle, and there's good air exchange. Cardiovascular, it is regular rhythm and rate on auscultation. There's no murmurs found bilaterally. So you look at her abdominal, it was a little bit distended. It is positive that it was firm, and there was no masses palpated. GU, she's female genitalia. Her femoral pulses are equal bilaterally, 2+. with no diaper rash noted. Skin-wise, there was no rashes, there was no lesions, there was no masses. It was good skin turgor, no dryness. Muscular skeletal, she had good hip dysplasia. There was no problem with hip clicking. So for her differential diagnosis, I came up with acute gastritis, number one. Number two, I came up with constipation, and her leading diagnosis, I chose infantile colic. And the plan for her is to manage her and reverse the cause. I plan to change the formula on her. I plan to do a UA to make sure there's no other signs of infection. I'm going to educate the mom on milk protein intolerance, how to swallow the baby for the inconsolable crying, do frequent burping, good diaper changes, and give her something to help her pass bowel movement to prevent constipation. I will see this child again in about 2 weeks to see how it goes. Thank you.